So I hope Dr. Anjusha has taken you through the introduction of Panchakarma, but I'll be taking you again through that. So let me know what are things you have learned. Language okay, like. Ready? So hope you like Panchakarma.
Yeah.
Food? Good.
Okay.
Okay. Fine. So happy to hear. We can only get that response from foreign students. Indians, after a week of this food, they will say, please change.
Really?
Yeah.
Why?
Because we eat more spicy food.
But it is already spicy.
For you, for not for us.
Okay.
Yes, for us.
I already feel
like the
spicy.
staff food is spicy, but then if we
It will
have
be very spicy for you, the staff food.
the patient food is
Passion fruit is good. Non-spicy.
Yeah. But after a certain period of time, you will also, your tongue needs some different taste.
Yeah.
So you will be longing for that. And how long you are here?
4
4
months.
months?
Just for a month.
No, 4 months.
4 months. Oh, that'd be good. Great. So I think probably you can introduce yourself because I don't know any one of you.
Okay. Sure.
Myself, Vinit from Kerala.
We need
My name is Ravi.
Mr. from
Vishal.
Michael?
Twin son, right?
Twins.
Michael from Germany?
Okay.
Mar from Colombia.
Mark.
Mar.
Mark.
M-A-R.
Mark. Good.
Sandra from Taiwan.
Oh, good. I have the whole world, a kind of.
And your name again?
Sajna.
Sajna.
From Kerala.
Sajna.
Sajna. Okay, so I'm practicing here for the past 13 years. And yeah. So basically, since I'm practicing, the point of view will be more practical. I'm not that good in teaching. So whatever doubt you have in between, you're free to ask. And let's go through it. It's a new term for you. You'll be having so much of doubts. And to the maximum, I'll try to avoid Sanskrit terms. In case if it comes in between, you can ask for it and we can clarify that. Okay. So yeah, from yesterday's session, what you have understood about Panchakarma? Let me know that first. From that, we'll go forward.
It's a process when we remove toxins and try to reestablish health in our system.
Okay.
And we try to take the ama or the toxins to some point of their body, so then we can expose all together.
Good. But why we are doing a Panchakarma procedure to expel these doshas or the ama from the body? Why not the medications are doing that process?
Because we need to get rid of the root cause of the disease.
Of course.
And through Panchakarma, through these 5 actions, we can get rid of the root cause, so otherwise the illness would come back.
To an extent, it is right. But there is a small change in that. Your understanding is well and good. So, have you joined the class before? You have an idea about all these things?
Yeah.
Good. So basically, you know that Panchakarma is 5 procedures. Basically, it is all kind of an external treatment procedures. Also, it includes medications. We have to give some medications internally and so far to extract this root cause from the system. So it is like a complicated procedures only, very intense. We call it as an invasive operating procedures. Like a same, we are operating a person, cutting him open and doing some surgeries. The same procedure, that intensity is happening in every body. But we are not using any knife, we are not cutting open, but the healing inside is happening in the same way. Okay, so that is why the rest part after the Panchakarma is as much as important that the treatment part. Okay, so during that part only the healing is happening. Okay, so the Purva Karma, that means the preparatory therapies of the Panchakarmas are also important. The main treatment is also important and the post treatment is also important. So together only we can call it as a Panchakarma.
What was the after Panchakarma,
Paschat Karma, we'll also call it as Samsarjana Karma, which includes a Samsarjana. It includes a specific diet. So we'll just go through it as a like a short notes from today this 1 hour session, and you'll be you'll be meeting me quite often for the coming few days because I'm going to take you continuous classes for another 3-4 days.
Oh, great.
Okay.
So Panchakarma is like an invasive treatment? It's
Invasive surgical procedure. So that's what we
Surgical.
tell the patients because they think that drinking ghee and having a loose bowel, what is the matter? I'm completely fine and I can do whatever I want and I can eat whatever I want. That is not the case. If they are not following the after karmas, the paschat karma, then they are going to be very sick than before.
Okay.
So they will only understand that after a certain period of time. So you need to always make the patient realize that this is as much as of important because after a surgery we'll call it as 45 days of rest
Yeah.
is completely needed.
Yeah.
So that much period of rest is needed for the Panchakarma procedures too.
Oh.
Okay. So take in that sense.
when you refer to surgical, what does it mean?
Surgical means quite deep procedures. Every surgery, you need to cut open a person. And for that healing, it takes nearly 45 to 90 days. So that context, we are telling that it can be considered as an invasive because we are not cutting open, we are not using any knife, there is no blood. So it is an invasive procedure. It's just to make you realize the importance of that. Okay, so we know that health is considered in Ayurveda has the balance of these three doshas. Like which are all the three doshas? Kapha. Vata represents what? Pitta represents
Fire? Water?
Fire.
fire.
Fire and water? Not both?
If you see in a Panchamahabhuta combination, yes.
Ah.
And Kapha,
Earth
earth.
and what?
Water.
So the balance of these things in the body is called as health, along with the balance of the manasika doshas, sattva, rajas and tamas. Okay, that is called as health. So whenever there is a deterioration from the health due to our improper lifestyle or food and habits, we have two methods to reverse it. So one is called shamana and the other one is called as shodhana. Okay, if you want me to write on the board, you can let me know, I can write the
Okay.
spellings.
You said the balance of which of doshas and what?
Balance of three doshas, Vata, Pitta and Kapha is called health. According to WHO, complete well-being of physical, mental and social well-being is called health, according to World Health Organization. But according to Ayurveda, balance of Vata, Pitta, Kapha along with the Mansika doshas of Sattva, Rajas and Tamas is considered as health. Okay.
Swastha. Swastha.
Swastha mityaphi diyate. Okay. So there are two types of treatments. One is Shamana Chikitsa and other one is Shodhana Chikitsa.
So tamas and manas?
Tamas, Rajas and Sattva?
Tamas? You said tamas?
Yeah, that is Manasika doshas. Sattva, Rajas and Tamas.
And you call this manas?
Manas, the mind.
Manas.
So, as in the body, we took the balance of Vata, Pitta and Kapha. For the balance of mind, we consider these three things, Sattva, Rajas and Tamas. Sattva means very divine, good and thing. Rajas
Yeah,
means
yeah.
a very active or a kind of energy, heat and things. Tamas means more of cool, calm, relaxed kind of state.
Manas?
Mind.
No, but what did you say after manas?
So balancing of manas, we need to balance these three doshas.
Okay.
Okay, so there are two types of treatment methods. So Shamana Chikitsa is basically done with medications, lifestyle changes, dietary changes. And Shodhana is Panchakarma, all external. There are so many external procedures other than Panchakarma too.
So Rasayana therapy is Shamana?
Is Shamana, and Rasayana therapy comes after the Shodhana also as a Panchakarma.
Okay.
So I'll tell you the like the way it goes, like a flowchart. So initially, once the patient comes, like if a patient is suffering from some kind of illness, initially anyway they will not come for a Panchakarma. They will only seek for a Shamana Chikitsa. So if you are not feeling well, if you have an indigestion, if you have a headache, so initially we'll go with the Shamana Chikitsa only. That's the normal protocol. But nowadays the trends are changing, and even though if they don't have any illness, because of this widespread of Ayurveda, people are interestingly coming and taking Panchakarma for themselves. That is also a very good thing. So not waiting for a disease to manifest, and before it is manifesting itself, we are clearing out the cause.
Okay.
So that is a good thing. But what's the normal procedure is a patient will come as an inpatient, and we will do first the Shamana Chikitsa. Okay, initially we will assess the patient, we will assess the doshas, and we'll talk to the patient, and we will assess what are the food they are taking, what are their lifestyle, and what are they going through. So their age and their physique, their mind, everything matters when we assess a condition. Okay, so once we assess the condition, then we will be first giving the medications. Okay, based on the doshas to balance. If it is Vata Pitta aggravated condition, we will be giving medications to balance Vata Pitta. And if the Agni is not proper, if the digestive fire is not proper, we will be giving medications to increase or decrease the digestive fire and to make it proper. And also they will give the medications to digest the Ama. Okay. So, and then we will be advising the lifestyle changes according, means what we feel which is not in a good way, which is not correct. So we will be advising them, and also the dietary changes that is needed according to their conditions. But what happens around among the patients, only the 50% of people follow all these things consistently.
50%.
Yeah, just 50%. In case if they have a skin problem.
This is for how long?
The medication, in order to find the effect of a medication, at least a patient should take it for a period of 1 month.
Okay.
Then only we can see some results in their body. Because there are more than 2,500 combinations of Kashaya as told in Ayurveda. But unfortunately, we don't have more than 200 or 250 combinations available now. And that too available medication is with adulterants. Not with the real herbs, because there's a large scarcity of herbs nowadays. We don't have mountains like before. We only have plots and villas nowadays. We don't have gardens, we don't have forests, and we don't have mountains. And of course, we don't have medicines too. So every medicines are very valuable. Please don't waste any Ayurvedic medications.
Yeah.
So among these, only 50% of people follow all these things. Okay. Even if they follow, they will miss 1 or 2 days and something will happen. Right? So, the result of this treatment, Shamana Chikitsa, will be hardly 30 to 40%. We will never get a 100% cure if the patient is not so regular in taking the medications and following the things that we advise. But what if the patient is following everything correctly and properly? Actually, we don't need a Shodhana Chikitsa.
Yeah.
Even the pacifying treatments are good enough for a patient to treat his conditions. Don't always think that without Panchakarma, the illness are not getting cured. Always we can cure a disease without a Panchakarma, but the patient should be very consistent about their medication and their lifestyle. Okay. We have patients, basically for autoimmune conditions and all, the pacifying medications are more useful than Panchakarma procedures.
Oh.
But should be consistent. So everybody should educate your patient before doing something on their body. They should know what they are going through. They should know the importance why we are doing all these things.
Medications are mostly herbal based, no?
Yeah, it's a different, you have gone through the Kashaya Kalpanas, no? The recording sessions.
Yeah.
There are different forms of medications, Kashayam, tablets, lehyam, ghee, basmas, many other forms. That's why I thought based on the person's physique, their strength, their digestive capacity and everything, we will be prescribing the medications. Okay. So, in case if the patient is not getting cured from all these things and we found out that the disease causing ama is so deep inside the body, then we will opt for a Panchakarma procedure. Okay. So, that comes as a Shodhana procedure. And for the Panchakarma, we can't directly do the Panchakarma. We have Purva Karmas. Pradhana Karma, that is the main procedure, and Paschat Karma, 3 P's. Okay, it's like if there is a weed, cutting the branches of a weed and letting it stay further is kind of a shamana chikitsa. But whenever there is a rain comes, whenever someone waters, the weed grows again. But plucking a weed from its root, there is no 0% of chance that it will grow back again. So that's how Panchakarma works. Taking out the things from its root. So the Purva Karma includes Snehanam,
Snehanam, Swetanam.
Snehanam and Swetanam. Pradhana Karma. This out. Anyone knows which are all the Panchakarmas?
Pradhana, doing the surgery.
Virana,
Tell one by one. First.
Niruna, Niruha,
Virejana,
Vamana, Vamana,
Amana,
Kayareka,
Nasyam,
Kayareka, Kayareka, Purgation,
that is Virejana. Virejana is purgation.
Like Asti?
Yeah.
Sur,
Masti.
Sirureka,
One more.
Rakta Moksha?
Very good. Final one is rectomotion. Virejana means purgation. Vamana means vomiting. Nasya means nasal instillation of medicine. Vasti means enemas. Rectomotion means bloodletting paralysis.
nasal installation.
Pardon?
What is installation?
Installation means putting something inside. That's a word meaning of installation. So in Nasya we'll be instilling medicated oils. Okay. Medicated oils, medicated ghees, or even fresh leaf juices, whatever, based on the condition. And the Paschat Karma.
Diet?
Pardon?
Yeah,
Yeah.
diet and-
Paschat Karma comes with diet and lifestyle changes. And the Rasana. Diet means politics, samsarjana, Karma.
So usually after treatment, like the Panchakarma, you won't be needing any medication?
No, that's why we need to continue the medications, diet, lifestyle, and the rasayana. Rasayanas are basically medications only. Until the Panchakarma, we will be giving the medications which is Ama Vajana, which is digesting the Ama. After the Panchakarma, according to our concept, there will not be any Ama. So that we are giving the medicines to balance the Agni. What happens after every Panchakarma is the Agni is getting very low. The digestive system will be much more imbalanced because we are giving a shock to the system. Every Panchakarmas are like very intense and very shocking for the body. So the level of Agni will be much reduced or imbalanced. So initially we need to bring a balance in the Agni. That's why the specific diet has to be followed, which is probably slowly improving your Agni along with the medications. So Deepana type of medications will be given. Deepana in the sense carminative, which is improving your Agni. Okay. And some modifications because you have to live a new life after you get a new body. After a Panchakarma, you are like, again you are, it's like a newborn baby again. Your body will be so fresh and very delicate. So there are chances of getting an infections are very high after a Panchakarma. So you should be very careful for the 1 or 2 weeks after the Panchakarma. In case if you are exposed to any kind of viral load or anything, the possibilities are very high. Your immunity is compromised during that period. So you should make the patient understand that this is a very crucial period. More important than the Purva Karma and the Pradhana Karma. The after treatment is very important.
Okay.
So they have to follow the medications for a particular period of time. They have to follow the diet. And once everything is well and good, and if their digestive fire is fine, and they started to feel the hunger again, they started to feel energy again, they started to sleep better, and we'll get a feel, no, I'm good. When you reach that point only, we have to start the Rasayana Karma.
Okay. So isn't it dangerous if somebody comes from abroad doing Panchakarma and then after Paschat Karma flying back?
Yes. We always say the patient because everybody want an instant result.
Yeah.
They can't give any instant results. That's why this 28 is actually we need the time. That only if you
28
stay for 28 days that complete that Paschat Karma we can complete. So 21 days we can manage. But 14 days and all it's like, I don't
Too
say
short.
it is very short and
Very
it's
short.
not that effective.
Okay.
So initially if you're coming for 28 days, then when you come in another 1 year if you're coming,
Yeah.
then you can stay for 21 days. In another 1 year coming, then 14 days will be enough
Oh, I
because
see.
body is used to that procedure.
Okay. Okay.
Then there is no more shock. Body know what is happening.
Yes.
So it can adjust to the changes accordingly.
Okay.
Okay. So yeah. Now we will go through the Purva Karmas one by one.
But usually, like here in India, people have the Panchakarma like more of how do you say, preventive treatment? Or
Indians have the knowledge of this, but they never do that. Nowadays, foreigners are doing the preventive Panchakarma more often than Indians.
but then if I'm like healthy and I do the Panchakarma, will it help?
It's not that none of us are healthy because it takes time for the disease to manifest only. I have some kind of problem in my system and you have some kind of problem in your system. Unfortunately, it has not manifested as a disease until now because we are not perfect. We are doing unhealthy lifestyle habits, eating foods, everything. Even though we are following very strictly, also once or twice we will do some cheat meals.
Yes.
So that will have some accumulation in our system. And it's based on person's capacity, it takes time to manifest as a disease. So everyone has this ama in their body. Okay, sometimes we feel like, no, I don't feel like doing anything. That feeling comes from ama.
Oh,
Okay, because there is a blockage in your channels. You don't have the energy to perform. So that comes from ama. We don't need a disease. But if you left this untreated or unattended, in another 5 or 10 years, it will be manifested as some kind of disease.
So how often would you recommend whenever we don't have like a specific issue, but
Once in 2 years.
once in 2 years? Oh,
It's based on how you're leading a life also. If it is a somewhat, okay, moderate, once in 2 years. If it's very hyper and very party going life, then once in a year. Okay. Everybody is taking that for like a promise like that, whatever you want to do and come and take a Panchakarma, everything is clear. Anyone has the Sanskrit knowledge?
sorry?
Anyone has Sanskrit knowledge?
Little bit.
Means the will be able
before?
to read Sanskrit terms? Allah. Sanskrit. If I write in Sanskrit, you will be able to read?
little bit.
Little bit. Good. That's nice. Okay. So Purva Karma means preparatory. Pre. That means before Panchakarma. Okay. So we have Snehana. First. What is called as Snehana?
Oilation.
Internal giving and external
What we will give internally?
oil and ghee.
And we can also give vasa, muscle fat.
Vasa?
Yeah,
Ah,
What did
muscle
you
fat.
say?
muscle fat. You know the dadus?
Datus, yes.
Yeah.
Mida.
Rasa, Rekta, Mamsa, Med, Asti, Majja.
Matcha. Oh,
Okay. So that is also a medium of Snehabana, but the person should have a hunger of an elephant to eat that. Okay. But there may be persons who are not satisfied by giving 300 or 350 ml of ghee. So those persons we can give vasa.
Vasa.
from which?
Yeah,
which
muscle fat.
muscle fat from an animal.
Yeah,
Which animal?
buffalo.
Buffalo.
Yeah.
Oh. Buffalo fat.
So it can be given as ghee, oil, muscle fat. There are 3 mediums for that. So we can give it is internally as well as externally, oil application. There are so many methods we'll discuss. So we'll give it a Snehabana internally.
So muscle fat is for people that
Have excessive hunger, have a very hyperactive digestive fire.
and ghee is then the middle one and oil is for the less hungry?
No,
or-
basically we tell that oil is for Vada dominant conditions and
Vata?
dominant disease conditions, and ghee is for Pitta dominant disease condition, and muscle fat is for Kapha dominant disease conditions. That's the way. So initially, do you have any idea of how to give us Snehabana? Anyone experienced an Ayurvedic treatment, any Panchakarma procedures?
Yeah.
Yeah.
But only 1 week.
Ah, 1 week.
1 week, very.
What Panchakarma in 1 week?
It was like in Kavalyadam, also only a dip of Panchakarma.
What do you have done in 1 week?
Like Abhyangam, ghee drinking, and then we did like Virichana, and afterwards a little bit of Rasayana.
Everything in 1 week. What an
Very short, huh?
nice package.
Yeah, I also got a very intense
That's the problem nowadays happening. People are only thinking about how to make money and how to market their things and not thinking about the patients and how they are going through it and what's the benefit of doing such kind of things.
Yeah.
Okay, and understand that Shirodhara is not at all a Panchakarma.
Yeah.
Shirodhara is not what?
Not a Panchakarma.
Oh.
So everybody is marketing like we are giving Panchakarma treatments like Shirodhara. So many hospitals are marketing like that, but please understand that is not a Panchakarma. We know that which are all the Panchakarma now. Okay. So the first one is ghee. So there are two methods of taking ghee. We can give it as not actually three methods. The normal method is increasing the dosage of ghee from day 1 to day 7. Basically, we'll give it for 7 days. Here we are following that protocol. Okay. So if you are starting from a minimum dosage of 30 ml, the next day it will be 60 ml. The next day it will be 90 ml. The other day it will be 120 ml. Then it goes to 150. Then it goes to 180. Then it ends with 200 ml. This is somewhat almost a normal protocol that we follow here. Okay. So, before starting the Panchakarma, we have already
This is 210 or just plain 200?
200. This is a rough figure. This should not be a thing you have to follow.
Okay.
Okay. Before this, the Agni of the digestive fire of the patient should be normalized and the Dipana Pachana medication should be administered as a Samshamana treatment, and after a 1 week of preparation only we are entering into the Purva Karma stage. Okay, not immediately after the admission of the patient we are going to administer the Panchakarma. The patient has to come, the 1 week will be an observation phase. How the patient is dealing with the things, how he is able to digest the food, how he is the medication is absorbed into his system, what is happening through slowly introducing the Ayurveda treatments into his body.
But 1 week since the person starting having the medication?
Yeah, at least we need 5 days.
Happens fighting.
Need to observe. How can we give without observation a ghee to a person in case if they have a liver problem?
Yes.
What will happen?
And
Everything will go worse.
will you do everything at the same time, like introducing the medication, introducing like diet?
Of course, when they come here, the diet is a normal thing. They will not get anything else to eat. Everybody is following a particular diet.
Yeah.
It will be very like a mild to moderate diet. And the medications will be starting according to their condition after the initial consultation. The detailed consultation
So
will be
you do
happening.
everything at the same time,
Yes.
lifestyle change, diet change, medicine.
Here it is easy because we are introducing or we are pushing them into a lifestyle.
Uh-huh.
They don't have any choice.
Uh-huh.
They have to go through this.
Yeah.
Because back home it is difficult because you do have so many choices. Here you don't have any choice. You will not have Wi-Fi. You will not, because every 6 o'clock the therapist will come and ring the bell. You have to wake up.
Oh.
So there is no choice. You are pushing them. You are training them. Okay. So,
But otherwise, if you have like a personal patient and we don't have like a retreat or like a place like this, would you advise to have everything at the same time or start the medication?
once we start the medications, the diet changes automatically come along with that because most of our medication have patya. Patya means particular diet. Because certain things you have to avoid while you are taking certain kashayams. So it comes as a package. And of course, if they want to get better, they have to follow everything, start everything all of a sudden only, like along with medication, food, lifestyle, everything need to be changed. Okay. So, after that, we have decided to introduce the ghee to a person and then we need to educate the person before giving the ghee. That is because you're training for a therapy session. You should know that Snehapanam is not at all a easy treatment. It seems to be very easy because the person has to just drink ghee, but after a 3 days or 4 days of time, it will drive the person very crazy. It will not be the same person again, same patient. They will be crying, they will be shouting, they will be very much irritated because they can't sleep. They will have so many loose bowels, they will vomit, and they will have hot flashes, and so many things. So, should be very patient with the patient. Okay.
So about the ghee, are they drinking in the morning with empty stomach
Then I'll tell you. So this is a normal protocol. In this protocol, we'll be giving the ghee in the early morning 6 a.m.
6
Why we are chosen that time means because ghee takes a longer time for digestion. If we give it at 10 o'clock, the patient can only have food by afternoon or 3 p.m. or something. May not feel hungry itself. So if you are giving in the morning, we have enough time for the patient to digest the ghee and also to take the food.
How long will be the stomach to
It
process
depends
the
on
ghee?
everyone's digestive capacity. We can't say a particular time. Some may digest in 1 hour, some may take 4 or 5 hours, some may take 24 hours.
So can they drink the water before ghee or after ghee or only
No,
ghee?
you're not supposed to drink water before ghee. It can create bloating and there are possibilities of nausea and vomiting. So, not immediately after ghee also. After drinking ghee, you can sip some hot water. Just sip, not drinking. So just wait for another 20 minutes after taking ghee and then you can drink. If you're thirsty, you can drink glasses of water or you can sip hot water.
Okay. And breakfast is possible?
It depends. If you feel hungry,
it depends.
they'll give you food.
Okay.
Otherwise, you have to wait until your burpings are clear.
Okay.
So every burp is important during the ghee.
Yeah.
Because you need to keep on asking the patient. So whenever the ghee is digested, that means the burps are clear and you are free to have your food. Until then you feel the taste of the ghee in your burps, that means the body is still digesting the ghee and you are not supposed to take the food. And why we are not taking food when we are taking ghee?
Maybe it's then harder to digest
Mm.
and it's too much for the body because
Yes. Because ghee itself is very heavy, it's guru. It's very heavy for digestion. And then we don't need anything else.
yes,
Guru.
But it's only fat.
heavy.
It's the
Guru is
heavy.
spelled as guru.
Yes.
Guru.
It's same.
Yes.
Yeah,
So it's the same root.
it's the same.
It's the same.
The guru, like the guru.
Yeah.
It's the same
Ah,
root.
no. Guru means teacher
Yeah.
in one aspect. And Guru, this is one of the qualities. There are 20 qualities, no? Vimshati gunas. So Guru and Lagu. Lagu means light, Guru
light.
means heavy.
Yes.
So this comes in this concept.
But then the spelling is different.
Same, spelling is
Oh.
same.
So I was wondering that because now some of them will drink olive oil in the morning. It's like with the empty stomach. It's like process the same like the ghee.
Yeah, we'll come to that. We finish the ghee and we'll come to oil. Basically. Nowadays, so many practices, YouTube practices are going on.
YouTube.
It's not classical, we don't have any classical reference for all those things, but we can justify the principles. Okay, so this is a normal protocol, this is the way it has to be administered. So slowly, this should not be, if the patient is unable to digest 30 ml of ghee within a time period of 2 to 3 hours, the next day you can't give them 60 ml. Just increase 10 or 15 ml more. Then it will be 45 ml. So we can't say that this should be the amount. It is always depends on the patient's digestive capacity. Okay. And there is another way of giving ghee, we call it as Madhyama Snehapana. In case if the patient is having any digestive issues like Crohn's problem, IBS condition, increased means hyperacidity, acid reflux. So in case if the patient is having those problems, then we will be taking a way like Madhyama Snehapana, but the same 30 ml of ghee will be given as divided dosage of 15 ml in the morning and 15 ml in the evening.
Can you repeat that? If the is having what?
If the patient's digestive capacity is very low,
Oh,
okay, and if the patient is having a problem basically on this digestion, like irritable bowel syndrome, Crohn's disease, hyperacidity, acid reflux, bloating, or anything related to stomach, then the line of treatment will be Madhyama Snehapana because they can't stay hungry for long. It can aggravate their problem.
so this would be a Vata person mostly, or
No, it can be depend on any one dosha or a combination of vada and pitta, pitta and vada, pitta or kapha, whatever it is. So based on the doshas, we will be changing the medication of the ghee. That means it is not pure ghee. You know that it is a medicated ghee. So we will be giving the medication according to the dosha predominance.
it has herbs?
It has herbs, definitely. If it is a Pitta Vada conditions, we will give sometimes Mahapitta Gridam. If it is a Vada Pitta, we can give some other. If it is a women disorder, we will be giving some Sukumara Gridam. Based on that, the ghee will be changed. But the procedure is same.
So this is the meaning of Madhyama Snehapana,
That means divided dose.
divided.
Yeah, the same 30 ml we are giving, but we are giving like 15 ml, 15 ml. So once this
It's
15 ml is digested, we will give them the
Divided
food.
2 drops. Okay.
Okay, so they are not tired. And even though if the person is very emaciated, lean and don't have much energy also, we can follow this protocol. And evening we will give the 15 ml and around 1 or 2 hours we can give them the dinner. Okay. So the, again the 60 ml will be divided into 30 ml dosages. So if the person is weak, you have to think like this.
You said 30 ml if what?
No, next day dose.
Oh, yeah, yeah.
Every other day the doses increase, no? That you can divide it into half.
It's same, only
Yes.
2 doses. Okay.
So this is Madhyama Snehapana. The next we will go.
So usually what time if they
Oh,
have
it's
the
like
dose?
6 a.m. if we give the ghee. Normally a healthy person will ask for a food around by 8 a.m. If evening 5 p.m. if we give the ghee, 7:30 to 8 p.m. normally. But it changes.
You mean during this time can have the ghee?
No,
Or
if
we
they
have
have
the
the ghee at this time, they will normally ask for a food around 8 a.m. Or a healthy means somewhat okay digestive fire. And evening if we give the ghee at this time, then around in again and 1.5 2 hours they will ask for the food. And it changes when we increase the quantity of ghee. It changes. And interestingly, what happens sometimes the patient will not feel hungry when they are taking 90 ml or 120 ml and will immediately digest and will ask for food when they take 180 and 200 ml. That's strange, but it happens quite a few times because their body get used to that, and it will start to digest very fast. Then only body knows that then only once I digest this only I'll get food. So it will digest. Body is actually very quick.
If they are having their ghee and then vomit, is that it means good digestion or not bad digestion?
So that is a samyak sneha lakshanas. Means when there is enough ovulated, body will start to show some symptoms. No, not signs, not symptoms, signs. So that is one of the samyak lakshanas. Now then we can realize that this is enough.
Okay.
We'll go to that. Okay. So next one is subdue sneha. This is another method of giving snehapana. Subdue. Subdue snehapana means uh, giving a larger quantity of ghee in a very short period. Okay, so we will be having only 3 days. So we will be dividing the doses like 50 ml, 100 ml, 150 ml.
We are only talking about ghee, right?
Ghee, yes. Oh, this can be done with oil also. The same procedures can be followed with oil. If the person is Vata dominant, if the condition is like that, the same thing can be given with oil also, medicated oils.
Okay.
Medicated castor oils or medicated olive oils, whatever oil can be
The
replaced.
oil can be decided by the body
Constitution.
constitution, right?
Basically not constitution,
Or
the
the
vigor
kapha,
ghee.
pitta,
Yeah. The vigor ghee, the problem causing doshas.
And will it be always medicated or sometimes?
Always better to be medicated, or if you are doing it by your own back in your home, you can use plain ghee or plain oil, even coconut oil, virgin coconut oil you can do. So in Sadhu Snehabana, it can be administered in periods like if the patient don't have enough time, or if the patient's condition needs an immediate cleansing.
we drink.
Yeah. The same method only, but the quantity will be doubled. And it will be for 3 days.
It will after the ghee treatment, right?
No.
It's the
This is
same
also
time.
one of the method we can give the ghee.
Oh.
In this method we can give, in this method we can give, and this method also we can give.
It won't be doing stimulously, right?
It won't be?
It won't be due at the same time, right?
No.
It's just
Any one
choose
of this should be decided. If the patient have enough time, the patient is well and good, have a very good digestive fire, the first method, slowly. If the patient's digestive fire is not well and good, then Madhyama Snehabana, divided dose. If the patient doesn't have enough time to go through all these 7 days of treatment and all, then Sadhya Snehabana, immediately will go increasing the dosages.
Even if it has poor digestion?
Even in this case, if the patient has poor digestion, we have to avoid.
So if we have a 7 days Panchakarma, maybe they will give us 3 days
Ghee.
oil.
So in this case also, if your digestive capacity is not that proper, we can divide this like 25 ml, 25 ml, 50, 50. Divide that.
And the time will be the same like ghee, right? Like if separate like Madhyama, Snadapana is the same, can do in the oil.
Yes. It is our patient's choice and yukti, like how we are deciding the things. Okay, that's how the importance of a doctor comes, no? Otherwise, everyone with this knowledge can treat anyone. So we need experience, basically experience, to select which one will be suiting which patient. Okay.
Both for the ghee and the oil, are they warm or is
Always warm.
always warm?
Okay. And while you are giving the ghee, it should be like there will be a glass of ghee, the medicated ghee, and a glass of like hot water, like hot,
Okay.
and a bowl of jaggery, because there is always a chance of low glucose because it's only fat, there is no glucose. So always we keep some jaggery, and most of the ghees taste horrible. Even though the normal ghee is tasting well and good, but all the medicated ghees are very horrible. Once you have undergone the Snehapana, the next time even somebody is opening a ghee bottle in front of you, you'll start feeling like nauseous. So it is, so just to change that taste from mouth also, we can give them a little bit of jaggery. It's fine. And also a little bit of hot water immediately after ghee.
You mean like powdered jaggery and
Yeah, natural palm sugar. It'll be good. Okay.
You are supposed to take the warm ghee like liquid and drink it?
Yes,
Like
not like solid one. We need to liquefy it, Now, you are not supposed to directly heat the ghee. You can just pour into a tumbler or a glass and keep it in a hot water. Then it has to liquefy. You are not supposed to directly keep it on the fire because it changes the property of that medicine. Once we heat a medicine, the properties of the medications will change.
Yeah.
You are not supposed to heat anything, not only ghee, oil, any medications. If you are preparing the medication, then you can heat it. If you just want to warm it, keep it in hot water and warm it.
Oh,
But then you will just,
Drink.
for instance, if it's 150 ml, can you take your time to drink it, or is it better just to have it all at the same time? Because 150 is a lot.
Oh, so that's no, we need to give a shock. It's a lot only. If you can have it, you can have it. Otherwise, we will be dividing it into 75-75. That's why I told you
Otherwise,
it's
you're
not
supposed
horrible.
to-
The patients will cry and beg before you to stop this. Because until we find the Samyak Lakshanas, we are not supposed to stop the Snehapana.
to
It's
find
not-
what?
Samyak, the enough oilated signs.
Ah, okay, okay.
Enough oilated. So when we will stop the Snehapana? It is not always the 7 days protocol. We need to stop it after the 4 days if the patient has showing the signs and symptoms of Samyak Snehapana. That we can discuss in the afternoon section because it needs some time.
How do you pronounce that?
Samyak, Samyak.
Some week.
What is
Samyak
Samyak?
means enough.
Enough. Okay. So, is there any ideal time when we get the warm ghee? How long we should like finish all the ghee? Is like within 10 minutes or 5 minutes? Or we can like put it in.
If you can drink
Slowly
it
drinking.
immediately, well and good. If you need time, it all depends. How can I say? If I take, no, I have undergone the Snehapana treatment. If I take hardly 5 minutes. When the days goes, I take 10-15 minutes. It's very difficult for me to take ghee.
Yes.
But there are patients who just come, will finish the prayer and just drank like they are drinking some mango juice or something. And they just go back very happily. So, we can't say how patients respond to this.
Okay. So, what is the average degree for the warm oil or ghee?
Until the entire thing is getting completely liquefied.
It's just enough so it will.
Liquefies.
Yeah.
Okay.
And also the medicated ghee, the ghee depends upon the condition of the patients. And basically we do the Sneha Karma, means the Sneha Bana for skin conditions and deeply rooted autoimmune conditions and conditions like joint diseases and everything, even though if it is not autoimmune also it will be good. And nowadays women's conditions like PCOS and now it has changed to PMOS, yeah. And all this endometriosis, women related conditions, we need a deep cleansing.
Okay.
In that case, only the ghee or honey, we can take it as a medium to get inside your system, to get inside each and every cells of you, and to forcefully extract the toxins from each and every cells and bring it back into your intestines or the stomach.
Okay.
So ghee is a medium for that.
But they are also intro.
Together, taking is contraindicated. But these two things have the quality like that. But ghee and honey in a warm state are not supposed to mix and to be taken.
No, I mean like also Sneana, for example, by morbus Crohn, you know, the disease of the inflammation in the
Crohn's.
Crohn's.
Yeah, that's
So
why I
we
told you
should
in
not
that
do it.
condition we can do Madhyama Snehapana.
Ah, okay.
Where we're
also
giving
in-
we have administered here and we are getting very good results.
Ah, okay.
So considering a patient, we can't just say that, oh, it can be done to Crohn's because every Crohn's patient should be different from one another.
Okay.
In Ayurveda, it is like everything is personalized,
Yeah,
individual. We can't generalize and say that, oh, for this disease we can give this.
Oh, I see.
According to the patient, we have to.
So for women, you recommend medicated ghee.
Not for women. If a woman is having problems, like if they have problem with your menstrual cycle, if they have problem with the menopause, so in those conditions we need a deeper level cleaning because it all based on the hormones. We need to rearrange the hormones. So that needs a deeper cleaning. Wherever we need a deeper cleaning, we need the ghee or the help of Panchakarma.
But you also mentioned honey.
Pardon?
You also mentioned honey?
Honey.
Yeah.
Honey is also having this capacity. So while we are giving medications, we can take honey in a larger quantity like ghee.
Oh.
Okay. So we take it as a medium for giving medications. In case if you are giving some mineral compounds to the patient, in order for a better absorption of that drug, we will mix that with honey and then we will give. So that the moment it touches your tongue, it will start to get absorbed into your system and will reach into the minor tissues, minor cells. So ghee and honey has this potency.
Like Anupana?
Yeah, not Anupana. Anupana is an after drink.
After drink?
Yeah.
How do you call it if it's like a
It
substance
should be
to-
taken along with the medications. I don't know what to call it in Ayurveda, means Sanskrit.
Okay.
It's not Anupana. Anupana means you take a medication and followed by that you drink
Followed
something.
by- okay.
That is Anupana. That is also increasing the efficacy of a medication.
Okay.
But this is you need to something mix with this medicine.
Together?
Yeah, for the easy assimilation of that medicine.
Okay.
It's like a medium to take the medicine everywhere.
Yes. Fastly.
Okay.
Okay. Then we have like few more minutes. You can ask the doubts in this. And we will start it as a Samyak Lakshanas from the next afternoon session.
I do have a question, but I was wondering, could you help me check these 5 different actions? Because based on the yesterday, I cannot really connect it with what you
Different
wrote
words, huh?
today.
Yes.
It's all different words and in different, I don't know.
Order?
It is not Ramana, it is Vamana.
It's not
Yesterday
romance.
we did.
Vamana?
We saw different words for the
Yes,
same.
and the progression is in different.
Virejanam, Nasyam, Niruham, it is a type of Vasti.
A kashayam.
Niruha Vasti means it is a Kashaya Vasti, Vasti with the decoction. Okay, but basically we call it as Vasti, as Panchakarma. There are 2 types of Vasti, Niruha Vasti and Anuvasana Vasti, one with decoction and one with oil. So one with decoction comes as a Panchakarma.
Yeah.
Okay, so we can either call it as just Vasti.
This new.
And this is not the 5th one. This is Vasti has 2 types. That is Niruham and Anuvasana.
Oh.
Okay, and the 5th one is Rekta Mokshana.
But,
Totally different.
but yesterday what they told
See,
us,
here it is correct.
Yeah, this is what you wrote today.
Yeah.
And I'm connecting yesterday.
Astra Visruddhi is also another word for Rekta Moshana.
yeah, what
is same.
they told us yesterday was that there were 2 different Ayurveda texts. And in these 2 different Ayurveda texts, the charyas, were mentioning different Panchakarma and Panchasadhana.
Panchashodhana.
Shodhana.
Yeah.
Right. So these are the Panchasadhana and these are the Panchakarma. This is what they told us.
Normally we take this as Panchakarma in application level. Okay. Don't confuse yourself because you are training for the application.
Yes.
Yes.
Okay. Not for theoretical knowledge and not for making others learn.
Oh.
Okay. So these are both of them are same first of all. Susruta called it in a different term and Vagbhata called it in a different term.
They,
So
they
this-
just told us that the bloodletting was not in this one.
Yeah, Susruta has told the bloodletting therapy and Vagbhata has not explained about the bloodletting therapy. He
Okay.
explained these 2 vastis as Panchakarma.
Okay.
Yeah.
But in our
Understood.
case for apply, we need bloodletting.
Yes.
Yeah.
So basically, once we do the Panchakarma, if we are doing a bloodletting therapy, we need to do a Purva Karma. We need to do the Snehapanam, we need to oilate the patient, and then we need to do the Svedana,
Yes.
then the sedation therapies, and then we have to do the bloodletting. Like Siravedana. Pardon? Sedation means steam. We'll go through it after the Snehapanam. Okay. And then we will do the Pradhana Karma, and after bloodletting therapy also we need a Paschat Karma, proper diet changes and things. So because of all these things, it also included as a Panchakarma. And it's a very intense procedure. How can we avoid that? Because we are cutting open and doing some
Yes.
bloodletting therapies.
You are what?
We are just, we'll do, there are different methods doing the bloodletting therapies. By Sira Vedana means we'll just cut the veins and we drag the coagulated or toxinated blood, and we put leech and we do cupping. So there are different types of procedures to do the bloodletting therapies.
Does the leech die if he takes our blood?
No, we need to purify the leech after the procedure.
How do you purify
And we'll put turmeric over the leech, and leech is very allergic to turmeric, so it will start to vomit.
And then
So
you
it
can
will vomit
use.
all those blood. So we need to completely squeeze the leech and to take out every toxic blood, and then we'll put it in fresh water.
And
And
he will
reuse.
If he is
survive?
lucky, he will survive. That's true. Normally survives, but sometimes.
Do you handle these leeches?
Yeah, we have leeches here. Yeah. For certain conditions, to get an
What-
immediate response, we need leech.
So
Where
in
do
Germany
you
it's not
put
allowed.
them?
No?
No, after use you need to kill because of hygiene.
It will die automatically.
No. No.
Normally, we don't use the same leech for
For the same
different
person.
persons. We use the same leech for the patient, and it should be served like kept aside. And it dies sometimes, not always. If we properly purify the leech, it will not die. We can use the same leech for the same person. Doesn't create any problem.
So where do you store the leeches?
In fresh water.
Like in a fridge?
No, in a fresh water, in a glass jar.
Refrigerators.
One leech in 1 year? Or do you have like a
How can
farm?
we say that? It depends on its lifespan. If the leech is surviving, we can keep it. We can't kill, no? Even if the patient left also, we can't kill a thing. So it will be in that glass jar only. We'll be putting the patient name over that and we'll be keeping it. If the patient comes for the next time and the leech is still alive, we can use it.
And do they reproduce the leeches?
No. There are people who are doing this as a farming.
Yes.
And they are selling us. Yes. Nowadays everything is business.
Yes.
But we should be very selective and knowledgeable when we are selecting the leeches, because there are so many poisonous leeches too.
Oh,
We are only supposed to take the freshwater leeches and with some qualities.
okay.
Okay.
Not like every leeches. There are so many poisonous leeches.
And this is all mainly for Rakta conditions,
Mainly for skin, kushta.
maybe for skin. Kushta.
And also for long-standing inflammations. If you have a very big swelling over your knee joint, ankle joint, elbow joint. So there is
that
a
it's very
stagnated inflammation. The inflammation is not moving in anything
Okay.
because the treatments are not finding effective.
Okay.
Then we have to put leech or doing reclamotion or something to move the things.
Inflammation for more than 6 months or something like that?
Yeah, deep-rooted, more than 6 months, and not having any change in the condition even after so many medications.
Okay.
If the pain is not coming down. And basically for arthritic patients and all, it works.
Also arthrose,
Arthritis,
arthritis.
For when it's like this?
too much swollen.
So if you have this and you have here and
We will not put everywhere where we have an inflammation. We have to find the purple location where it is more stagnated and where it needs an opening.
Okay.
It should be examined and then it has to be applied. And alopecia conditions, if you have hair fall, severe hair fall, that condition also. The thing is to improve the circulation in that area, and the leech is having a particular anticoagulant called hirutin, which helps to dilute the blood.
Yes.
In that case also, wherever it is needed.
Okay.
We have so much of things in our hands. We can just put wherever it is needed, just apply.
But this is more of a rare treatment, or is something
Not
you
There are
usually-
hospitals which only does this. Only Raktamoshna. They are only focused on that. Because very fast results. You immediately will get the result, but it will not last long if you've not done it properly. You have to repeat it. For varicose vein and all, it's a very good treatment.
For varicoses?
Varicose vein, yeah.
Oh, okay. You put it on the varicose? On the
DVT,
vein?
varicose vein. We'll find out the vein which is much more blocked.
Okay.
And just put it.
Oh.
It will be easy. The pain will be reduced in half an hour.
Oh.
Patient can
But
walk
then
away.
you have to repeat it
Yes,
constantly.
yes. Quite often you have to repeat.
But then you will never be completely cured of this.
You have to take the internal medications too along with this in order to get a complete cure. That is applicable for every Panchakarma. Everything you have to continue the medication
Yeah.
to fix that.
But this needs to be repeated more often than the other treatments, right?
If it is rectal motion, yes.
Okay.
It's a short-term relief. Like the cupping therapies, no? Nowadays it's very common cupping in Kerala.
What is cupping?
The acupuncture
The cube,
treatments.
Like something.
Yeah.
Chinese medicine.
Yes.
Yeah.
That is also explained in Ayurveda.
Oh.
That's very common nowadays.
This
But
is
people are
also
not getting a
Ayurveda?
complete cure out of that.
Okay.
They'll get an immediate relief,
Yeah.
pain relief.
Yeah.
This is also from Ayurveda.
Maybe we can say that the Chinese medications has been taken out from Ayurveda. When an Ayurveda Acharya went to China and they got like interested from his learnings and they started to learn, and then they have introduced their own medications. They got an idea from Ayurveda, but they have not completely taken this. They have introduced their own medications for that. It's a method. There are so many look-alike methods.
So what's the name in Ayurveda for this cupping?
Alabu.
Ah,
Labu.
alabu with
Yeah.
double U.
We'll call it, we will do it with animal horns, not with the scups. It was supposed to be done with animal horns. But nowadays everybody uses
Animal horns, really?
Yeah.
Oh.
hollow horns of animals.
Okay.
We just use. We need that hollow vacuum space to collect the blood.
Oh.
Do you do this?
We don't do cupping here. Not yet. Maybe in near future sometimes.
But you learn and have
Yes,
done it
yes.
sometime in your life. Are you learned here or somewhere else?
No, I learned from Coimbatore, Ayurveda Pharmacy. The same college where all the medical directors of this institution passed out, no? Dr. Ramkumar, Dr. Ramdas.
Okay.
We are all from same college.
So you know each other for a long time then?
Yes.
And then you decided to build up this
No,
Vaidyagrama?
they decided to build up. They are my super seniors.
Okay.
But I joined here after 1 year completing my course.
Okay.
So it's more like my family now.
How long have you been here?
No, it's been 13 years.
13. You look so young. Wow.
Power of Ayurveda.
Power of Ayurveda. Amazing.
Yeah.
Everyone looks so young here. Amazing.
Because no, I have taken twice Panchakarma treatments. I am getting admitted this month for another Panchakarma treatment. So if you believe in the science and if you try to follow that, it will have the benefit of it.
What Panchakarma are you doing?
It's Snehapanam only. Because I know my lifestyle. It's not that perfect. So I'm just taking it as a prevention.
Okay.
Okay.
Okay, so we'll meet in the afternoon for the continuation of this class with the Snehapanam Samyak Lakshanas.
Okay.
Okay? Thank you.
Thank you.
I know how to stop this recording.
You put recording. Put here. I really like this class.